Welcome to Chapter 15 on Psychological Disorders. In this chapter, we will look at defining and explaining abnormal behavior, anxiety-related disorders, disorders involving emotion and mood, dissociative disorders, schizophrenia, personality disorders, suicide, and health and wellness. Abnormal behavior is behavior that is deviant, maladaptive, or personally distressful. Only one of these behaviors needs to be present for the behavior to be considered abnormal, but they may all be present. Deviant behavior is a behavior that does not conform to accepted social standards. The context of a behavior may determine whether it is deviant. Maladaptive behavior interferes with a person's ability to function effectively in society. Personal distress involves an individual who feels troubling emotions for a prolonged period of time as a result of their behavior. The biological approach refers to disorder causes that are organic and internal. Drug therapy is often used to treat the disorder. The medical model describes psychological disorders as medical diseases with a biological origin. The psychological approach emphasizes the contributions of experiences, thoughts, emotions, and personality characteristics to explain psychological disorders. Behavioral psychologists focus on the rewards and punishments in the environment that determine the abnormal behavior, and the social cognitive psychologists focus on observational learning, cognitions, and behaviors as factors that foster abnormal behavior. The sociocultural approach places more emphasis on larger context in which a person lives. The role of deviance in determining abnormal behavior suggests the importance of sociocultural factors in psychological disorders. Cultural matters in complex ways are also involved. Cultural variations make it difficult to compare psychological disorders from one culture to another. The biopsychosocial model emphasizes the interaction of biological, psychological, and sociocultural factors. A classification system provides a common basis for communicating and can also help doctors make predictions. An individual who is suffering from psychological symptoms might also benefit from having a name for their symptoms, although labeling can lead to stigma. The Diagnostic Statistical Manual of Mental Disorders, or the DSM, was first developed in 1952. In its current version, the DSM-V was approved in 2013, which was a product of a 14-year revision process. Through the history of the DSM, the number of diagnosable disorders has increased dramatically. The World Health Organization devised the International Classification of Diseases and Related Problems, called the ICD-10, which includes a chapter on mental and behavioral disorders. One of the goals of the new DSM-V was to be closer to the ICD-10 in defining diagnoses, though the two manuals remain different in important ways. There are critiques also of the DSM. A central criticism across all versions of the DSM is that it treats psychological disorders as if they are medical illnesses, taking a largely biological view of psychological disorders. Another criticism is that it focuses on problems and does not emphasize strengths as well as weaknesses, which might help to destigmatize psychological disorders. It relies too much on social norms and subjective judgment. Too many new categories also have been added is one critique, some of which do not have enough consistent research to support them. It loosened the standard for some existing disorders. A higher rate of diagnosis will increase the number of people who receive insurance coverage, but it might also lead to higher rates of prescribing medications. Autism spectrum disorder refers to a range of neurodevelopmental disorders which might involve impaired social interaction and communication, repetitive behavior, and restricted interest. The level of disability associated with autism spectrum disorder can be relatively mild to severe. However, early intervention is particularly helpful for children diagnosed with this disorder. Somatic symptom disorder, formerly known as somatoform disorder, involves a patient experiencing a physical symptom which then results in excessive thoughts and feelings related to the symptoms. Another controversial disorder in the DSM-V is attention deficit hyperactivity disorder, or ADHD. Researchers debate the potential overdiagnosis of this disorder as well as over-pathologizing normal behavior. It is traditionally considered a childhood disorder, and the majority persist to adulthood. Anxiety disorders are psychological disorders that feature motor tension, hyperactivity, and apprehensive expectations and thoughts. These disorders involve fears that are uncontrollable, disproportionate to the actual danger, and disruptive of ordinary life. Some anxiety disorders are generalized anxiety disorder, panic disorder, specific phobia, and social anxiety disorder. With generalized anxiety disorder, sufferers experience persistent anxiety for at least 6 months, and they are unable to specify the reasons for the anxiety. Individuals with generalized anxiety disorder worry a lot of the time about minor things. The anxiety usually shifts from one aspect of their life to another. There are biological factors that include genetic disposition in the neurotransmitter GABA, respiratory system abnormalities, and problems in regulating the sympathetic nervous system. There are also psychological and sociocultural factors that have been found to contribute to the disorder. Panic disorder is when an individual has recurring sudden onset of intense terror. Panic attacks may occur without warning and produce severe palpitations, extreme shortness of breath, chest pains, trembling, sweating, dizziness, and a feeling of helplessness. Individuals with the disorder must have a genetic predisposition for it. They may have an autonomic nervous system that is predisposed to be overly active. The individual with the disorder may have problems with norepinephrine, GABA, or serotonin neurotransmitters. Lactate has also been found to be elevated in individuals with panic disorder. Classical conditioning research has shown that learned associations between bodily cues of respiration and fear can play a role in panic attacks. Generalization may also play a role in the development of panic attacks in the form of overgeneralization of fear learning. Women are twice as likely as men to have panic attacks and agoraphobia. A specific phobia occurs in an individual with an irrational, overwhelming, persistent fear of a particular object or situation. A normal fear becomes a phobia when the individual will go to extreme lengths to avoid the object or situation. Specific phobias can be seen as extreme and unfortunate variant of the adaptive role that fear plays in our survival. Many explanations of specific phobias view these based on experiences, memories, and learned associations. Since not all people with phobias can readily identify experiences that explain the phobia, other factors than experiences may also be at play. Here are some examples of some phobic disorders. Social anxiety disorder is also called social phobia, which is an intense fear of being humiliated or embarrassed in social situations. Genes appear to play a role in the development of social anxiety disorder along with neural circuitry involving the thalamus, amygdala, and cerebral cortex. Vulnerabilities such as genetic characteristics or parenting styles lay the foundation of risk, combined with learned experiences in a social context. Individuals diagnosed with this condition often feel that their anxiety prevents them from being authentic. Research suggests that authenticity is related to well-being. Obsessive-compulsive and post-traumatic stress disorders are anxiety-related, but not classified in the DSM-V as anxiety disorders. Obsessive-compulsive disorder involves anxiety-provoking thoughts that will not go away and/or urges one to perform repetitive behaviors to prevent or produce some future situation. Obsessive-compulsive disorder is not categorized as an anxiety disorder, but it's placed in a different category even though the individual does experience anxiety-related symptoms. Obsessions are recurrent thoughts which create the anxiety, and the compulsions are the recurrent behaviors an individual does to try to cope with the anxiety. Some individuals with this disorder repeat the behavior hundreds of times a day. The most common compulsions are excessive checking, cleansing, and counting. Most of the individuals do not enjoy this ritualistic behavior, but worry that if they do not carry it out, Most individuals do not enjoy the ritualistic behavior, but they worry and have increased anxiety when they do not perform them. There is some genetic component because OCD runs in families. Research points to low levels of neurotransmitters such as serotonin and dopamine and high levels of glutamate in the brain pathways. One interpretation of this research suggests that the frontal cortex or basal ganglia and thalamus pathway may be involved in a feeling that something just isn't quite right. Learning processes are also implicated. Avoidance learning might be an important contributor to the maintenance of the symptoms. In terms of psychological factors, OCD might involve a cognitive bias associated with overestimating threats. The DSM-V expanded the disorders that are thought to be related to OCD. One is hoarding. A hoarding disorder involves compulsive collecting, poor organizational skills, and difficulty discarding items as well as cognitive deficits. Excoriation, which is skin picking, refers to a particular compulsion of picking at one's skin, sometimes to the point of injury. Trichotillomania, which is hair pulling, is a disorder in which the person compulsively pulls out his or her hair from the scalp, eyebrows, and other body areas. Body dysmorphic disorder involves a distressing preoccupation with imagined or slight flaws in one's physical appearance. Individuals cannot stop thinking about their appearance, comparing their appearance to others, and checking themselves in mirrors and so forth. Post-traumatic stress disorder develops through exposure to a traumatic event. PTSD can occur not only in those who directly experience a trauma, but in those who witness it or hear about it happening to someone that they care about. Some of the symptoms of PTSD are flashbacks, constricted ability to feel emotions, excessive arousal, difficulty with memory and concentration, feelings of apprehension, and impulsive outburst of behavior. PTSD may immediately follow the traumatic event, or it may occur months or even years later. The symptoms of PTSD will vary, and many will include flashbacks, avoidance and emotional numbing, distressing emotions such as anxiety, guilt, difficulty with memory and concentration, and impulsive behavior. Mood-related disorders involve a disturbance of mood that affects the entire emotional state. Symptoms may include cognitive, behavioral, or physical symptoms and interpersonal difficulties. Major depressive disorder is one of the types of mood-related disorders. Bipolar disorder is a mood-related. Also, bipolar disorder is mood-related, but it is not a DSM-V mood disorder. With depressive disorders, the individual suffers depression, especially an unrelenting lack of pleasure in life. Some individuals develop major depressive disorder while others develop persistent depressive disorder, which is a more chronic depression with milder symptoms. Major depressive disorder involves a major depressive episode and depressed characteristics for at least 2 weeks. The symptoms of major depressive disorder are depressed mood most of the day, reduced interest or pleasure in all or most activities, significant weight loss or gain, and significant decrease or interest reduced interest or pleasure in all or most activities, significant weight loss or gain, or significant decrease or interest in appetite, trouble sleeping or sleeping too much, psychomotor agitation or retardation, fatigue or loss of energy, feeling worthless or guilty in an excessive or inappropriate manner, problems in thinking, concentrating, or making decisions, and recurrent thoughts of death and suicide. Persistent depressive disorder involves an individual having a less extreme depressed mood for over 2 months, with other symptoms such as hopelessness, lack of energy, poor concentration, and sleep problems. Various factors have been implicated in the development of depressive disorders. Biological factors may include genetics, lower level of brain activity in a section of the prefrontal cortex, suggesting a depressed person's brain may not recognize pleasurable opportunities, and a decrease in receptors for neurotransmitters such as serotonin and norepinephrine. Psychological factors may include behavioral learning theories, such as learned helplessness, while cognitive views try to explain depression through the types of thoughts and beliefs that contribute to the sense of hopelessness. Cognitive factors also include the types of attributions people make to explain what caused something to happen. Pessimistic attributional style involves blaming the self or negative events and expecting these events to happen again in the future. Sociocultural factors may include low socioeconomic status, especially living in poverty. Gender also appears to play a role in the disorder. Cross-cultural research indicates that women are more likely to be diagnosed with depression than men. Bipolar disorder is characterized by extreme mood swings with at least one or more episodes of mania. The bipolar part of it means that the individual experiences both depression and mania. Most individuals with bipolar disorder experience many episodes of depression interspersed with episodes of mania. During a manic episode, the individual feels euphoric and on top of the world. The individual may be impulsive and find themselves in trouble in business and legal transactions. The severity of manic episodes is used to distinguish between the two types of bipolar disorder. Bipolar disorder is equally common in men and women, and there are genetic influences that are stronger predictors of bipolar disorder than depressive disorder. Brain imaging shows decreased metabolic activity in the cerebral cortex of those suffering from a depressive episode and increased activity during manic phases. Abnormal levels of norepinephrine, serotonin, and glutamate have often been found implicated in the disorder. The DSM-V includes disruptive mood dysregulation disorder, a new depressive disorder in children who show persistent irritability and recurrent episodes of out-of-control behavior. Disassociation refers to psychological states in which individuals feel disconnected from their immediate experiences. Dissociative disorders involve individuals losing their memory or having a change in their identity. Aspects of the consciousness are split and they function independently of each other. Dissociative personality usually occurs in individuals that show signs of PTSD. Evidence that these disorders are related to consolidating emotional memories is supported by research demonstrating abnormalities in the hippocampus and the amygdala. Dissociative amnesia is characterized by extreme memory loss that is caused by extensive psychological stress. Sometimes individuals suffering from dissociative amnesia unexpectedly travel away from home and may even assume a new identity. Dissociative identity disorder, formerly called multiple personality disorder, is the most dramatic, least common, and most controversial dissociative disorder. Individuals with this disorder have two or more distinct personalities. One personality will dominate at one point in time and another at another. The personalities are separated by a wall of amnesia. According to some psychologists, some personalities emerge as the result of therapy. Research has shown that dissociative identity disorder is linked with high rate of severe sexual or physical abuse during early childhood, although not all individuals that have been sexually or physically abused develop dissociative identity disorder. Some experts believe that DID is a social construction. It represents a category that some people adopt to make sense out of their experiences. Psychosis refers to a state in which a person's perceptions and thoughts are fundamentally removed from reality. The DSM-V recognizes a class of disorders called schizophrenia, spectrum, and other psychotic disorders. Schizophrenia is characterized by highly disordered thought processes. The suicide risk for individuals with schizophrenia is 8 times that of the general population. The disorder is usually diagnosed in early adulthood. There are positive and negative symptoms of schizophrenia. The positive symptoms are marked by a distortion or an excess of normal function. They are called positive because something is being added and goes beyond the normal behavior. Hallucinations are experiences in the absence of real stimuli. They are usually auditory, where the individual may experience hearing voices, or visual, where they see things that are not really present. Hallucinations can also involve other senses such as smell and taste. Delusions are false and magical beliefs that are not part of an individual's culture. Thought disorder refers to unusual, sometimes bizarre thought processes that are characteristic of individuals with schizophrenia. Thoughts can be so disorganized and confused that the person doesn't make sense when they talk and write. The individual might also make up new words known as Neologisms. Referential thinking occurs when an individual gives personal meaning to random events. Disorders of movement involve unusual mannerisms, body movement, and facial expression. Catatonia is a state of immobility and unresponsiveness. Negative symptoms are behavioral deficits and a loss or decrease of normal functions such as social withdrawal. An individual with a flat affect shows little or no emotion, speaks with emotional inflection, and maintains an immobile facial expression. An individual with a flat affect shows little or no emotion, speaks with no emotional inflection, and maintains an immobile facial expression. Individuals with schizophrenia may also have difficulty reading the emotions of others and show an inability to plan, initiate, and engage in goal-directed behavior. Cognitive symptoms include difficulty in executive functioning, such as sustaining attention, problems holding information in memory, and the inability to interpret information and make decisions. Another neurotransmitter implicated in the certain cases of schizophrenia is serotonin. There are biological factors involved with schizophrenia. Research provides a strong evidence for biological explanations. Genes schizophrenia is partially due to genetics. There's also structural brain abnormalities. MRI scans show large ventricles in the brain of schizophrenics, suggesting brain deterioration. Schizophrenic individuals also have small frontal cortex and show less activity in this area compared to healthy individuals. The brain differences between normal and healthy individuals and those who are schizophrenic are small. Many of the changes appear to be prenatal. In terms of neurotransmitter regulation, dopamine regulation plays a role in schizophrenia as well as abnormalities in the specific types of glutamate receptors. Under psychological factors, the vulnerability stress hypothesis argues that a combination of biological predisposition and stress are the cause of schizophrenia. Sociocultural factors appear to affect the course of the disorder. Individuals living in developing, non-industrialized nations tend to have higher outcomes. In terms of sociocultural factors, sociocultural background appears to affect the course of the disorder. Individuals living in developing, non-industrialized nations tend to have better outcomes than those living in developed, industrialized nations. Warm family relationships and employment also appears to serve as a protective factor in Western nations. Personality disorders are chronic, maladaptive, cognitive behavioral patterns that are integrated into the individual's personality. These disorders affect a person's sense of self and capacity for relationships with others. Two personality disorders have been the objects of most studies: antisocial personality disorder and borderline personality disorder. Individuals with antisocial personality disorder are characterized by guiltlessness, law-breaking, exploitation of others, irresponsibility, and deceit. And it is also characterized by the failure to conform to social norms and obey laws, deceitfulness, lying, conning others, or for personal profit or pleasure, impulsivity, irrationality, strike that, irritability and aggressiveness, getting into physical fights, reckless disregard for the safety of others, consistent irresponsibility, inconsistent work behavior, like not paying the bills, and a lack of remorse, showing indifference to the pain of others. Generally, antisocial personality disorder is related with criminal behavior, but not all individuals with this disorder engage in crime, and not all criminals suffer from it. Antisocial personality disorder is genetically heritable, and certain genetic characteristics interact with testosterone to promote antisocial behaviors. It has been linked to low levels of activation in the prefrontal cortex and has related these brain differences to poor decision-making and problems in learning. Researchers have found that individuals with this disorder are less stressed by aversive circumstances like punishment and have the ability to keep their cool while engaging in deception. This potentially means these individuals could fool a polygraph. Psychopaths are a group of individuals with antisocial personality disorder who are remorseless predators engaging in violence to get what they want. Research on individuals with antisocial personality disorder show lower levels of gray matter, which may be associated with empathy and deficits in theory of mind. A key challenge in treating individuals with antisocial personality disorder, including psychopaths, is their ability to con even sophisticated mental health professionals. Individuals suffering from borderline personality exhibit a pervasive pattern of instability in interpersonal relationships, self-image, and emotion. They are often insecure, impulsive, and emotional. It can also be seen as BPD is related to self-harming behaviors such as cutting and suicide. BPD is characterized by four essential features: an unstable affect, unstable sense of self and identity, including self-destructive impulsive behavior and chronic feelings of emptiness, negative interpersonal relationships that are unstable, intense, and characterized by extreme shifts between idealization and de-evaluation, and self-harm, including recurrent suicidal behavior, gestures, or threats, or self-mutilating behavior. BPD is more common in women than men, and among those in lower socioeconomic levels and those younger than 30. Biological factors such as genetics play some role in the causation of BPD. Childhood experiences such as sexual abuse, physical abuse, and neglect may also play a role in the development. These experiences, along with the genetic factors, indicate a vulnerability stress explanation for the disorder. Cognitive factors such as irrational beliefs and hypervigilance are also potential factors in the development of the disorder. An either-or thinking style known as splitting is common in individuals suffering from BPD, by which they either view people as hated enemies or as beloved friends who can do no wrong. Dialectical behavioral therapy has been shown to be an effective treatment in the disorder. Suicide is the second leading cause of death in American adolescents after accidents, and over 41,000 people committed suicide in the U.S. in 2013. Thinking about suicide is not necessarily abnormal, but attempting or completing the act is abnormal. Suicide research has shown that low levels of serotonin are linked to suicide, and poor physical health is another risk factor. Psychological factors that can lead to suicide are psychological disorders and traumatic experiences. The most common psychological disorders that lead to suicide are depression and anxiety. Substance abuse and an immediate and stressful circumstance are also linked. Thomas Joyner, an expert on suicide, proposed the interpersonal theory of suicide, which suggests that suicides involve two factors: one, a desire to die, and two, the acquired capability for suicide. Sociocultural factors suggest that suicide rates vary worldwide, and that the lowest rates occur in countries with cultural and religion norms against suicide. Research has also linked suicide to the culture of honor. Rates of suicide are higher in areas with the culture of honor. While women are more likely than men to attempt suicide, men are 4 times more likely to complete suicide than women, due to the higher likelihood that they will use a more lethal manner to commit the act. When someone is threatening suicide, take it seriously. Calmly ask simple questions. Be a supportive listener. Emphasize the unbearable can be survived, and stay with that person until you can get them help. Also, encourage them to get professional help. You never leave someone who has made a suicide statement alone. And don't promise them to keep it a secret. Always get them to someone so that they can get help and be taken care of. When someone is threatening suicide, things you should not do, don't ignore the warning signs. When in doubt, ask them. It is a myth that if you ask or mention suicide that somebody will actually commit the act. Don't refuse to talk about it. Don't react with horror or disapproval. Don't lecture them judgmentally. Don't abandon them once the crisis seems to have passed. Make sure you get them to someone who can help, like a counselor, an administrator, a professor, anyone. It is better for them to be angry at you for getting help than for them to be dead. Psychological disorders are just not about other people. They are about people and can occur in anyone. Psychological disorders present challenges to living healthy, fulfilling lives. These individuals attempt to overcome such obstacles as stigma, stereotypes, prejudice, and discrimination. Studies demonstrate that psychological labels carry with them a wide range of implications and can create significant barriers for individuals to overcome and to cope with. Stigma can be a significant barrier for individuals who are diagnosed with a disorder as well as their families and loved ones. Consequences of stigma have been prejudice and discrimination, and psychological labels can lead to negative stereotypes which play a role. Some examples are the Virginia Tech and Sandy Hook murders, which have perpetuated the notion that individuals with psychological disorders are prone to violence. Yet this impression is an illusory correlation. Individuals with these disorders are very aware of the negative stigma and connotations others put on them, since they might have once held similar attitudes. One of the most feared aspects of stigma is discrimination. The American Disabilities Act of 1990 made it illegal to refuse employment or promotion to someone with a psychological disorder when the disorder does not prevent the person from performing the essential functions of their job. Individuals with psychological disorders are more likely to be physically ill, obese, smoke, drink excessively, and lead a sedentary lifestyle. Research has shown that health promotion programs work well for individuals with severe psychological disorders. One obstacle challenging people's attitudes towards individuals with psychological disorders is that mental illness is often invisible. Resist thinking of people with disorders as limited individuals. Rather, recognize their strengths and their achievements. So in review in this chapter, we have defined the characteristics, explanations, and classifications of abnormal behavior, distinguished amongst the various anxiety and anxiety-related disorders, compared disorders involving mood and emotion, described the dissociative disorders, characterized schizophrenia, identified the behavior patterns typically of personality disorders, and described suicide and its risk. We've also looked at explaining how psychological disorders affect health and describe how individuals with disorders can improve their quality of life.